Hi, I'm Tama Lundquist, co-president of Houston Pet Set. I'm joined today by my co-president, my sister, my twin, Tena Lundquist Faust, and we will be talking to a very good friend of ours. Hi, Tena.
Hi, Tama.
Okay, today we're going to be highlighting two important pillars that Houston Pet Set works on. One of them being spay and neuter, and the other being community resources. So working in the community to make sure that the needs are being met for those people who have animals.
Our guest today is Dr. Amy Crum, who with the support of Houston Pet Set operates and manages an animal health mobile unit right here in Houston. Dr. Crum serves on the front lines in ensuring that we're elevating the status of companion animals. Dr. Crum, welcome to our conversation for the animals. How are you?
I'm great. Thank you so much for having me.
We're so glad to have you. Dr. Crum, tell us just a little bit about yourself. Why did you choose veterinary school, and how long have you been here in Houston?
Well, I, like a lot of veterinarians, have wanted to become a veterinarian as long as I can remember. I grew up in rural Utah, in a tiny, tiny town. It struck me growing up that there were animals who seemed to be very well cared for and animals who seemed to not be getting the food or the veterinary care that they needed to be comfortable. And there really wasn't there was no system in place to either report that or to address it with resources. And so I think that really shaped the type of veterinarian that I wanted to become. Prior to veterinary school, got all of my experience by working in shelters. And so then I trained as a shelter veterinarian. I was the medical director at the Houston SPCA for 5 years. And then my experiences at the Houston SPCA led me even more to want to push resources out into the community to make sure that the animals in homes are getting the care and attention and resources that they need. And so that led me to start my own 501c3 organization, Laurels House, to help achieve that goal.
So great, so important in our community. Dr. Crum, we met you almost a year ago for the first time. We've done some incredible work together, you doing the more front lines work, but we've done a lot together since then. Can you tell our viewers how the whole mobile unit between our collaborations came to be and what sparked the idea for doing mobile units?
Yes, so our goal at Laurel's House has always been to provide free veterinary care and to really attack spay and neuter in a data-driven, targeted way. And I had talked with Miller Friedman on the Houston Pet Set team about that goal quite a bit while volunteering at the Empty Shelter Project events. So he knew that I was, a like-minded individual in the community trying to work on this problem. And then, so Houston Pet Set was contacted by Fido Fixers, who had a mobile unit available. And because I had been speaking with Miller, he knew that, that was something that I would potentially be interested in being involved with, which I very much am. And so it was just a very fortuitous how it happened.
It really was how it all came together. We had wanted to increase our spay and neuter presence in Houston. We had talked about it. Tina and I met somebody at an event, a nonprofit event, who led us to one person in New York who led us to Fido Fixers and talking to them. And this mobile unit basically dropped in our lap, but we had nobody to operate it. Lo and behold, Miller said, "Whoa, I have somebody." And we met you and then we got wonderful funding from our supporters of Lola's House and or Lola's Lucky Day. And so everything fell into place, and this idea that sparked in December basically became a reality by the end of January of last year. And we haven't slowed down since, that I know of.
No, I think it's such a great example of how much good you can do in a community when you collaborate. It's been an amazing experience.
Yeah, so true, so true. And I'm so glad you bring up collaboration because that's what Houston Pet Set is built on. So we believe in that too, and we're so lucky to be partnering with you on this. Dr. Crum, it's a very broad question, but take us through like a day in the mobile unit. What does it look like, whether you're spaying and neutering or doing emergency services? What does your day look like?
Yeah, so we will arrive on a location about 6:15, 6:30 and get everything set up and ready for the day. Make sure all the kennels have nice, fresh, clean, fluffy blankets for the pets. And then we will start check-in at 7 a.m. Usually we have way more people arrive seeking care than we can accommodate in a day, unfortunately. If I could just spay and neuter all day and all night long, I would, but everyone has limits. So we take in as many as we can every spay and neuter day. We have two technicians for each spay and neuter day, and one veterinarian, and then a person manning the outside of the bus, talking with people, answering any questions that they have about their pets or about the procedure. Talking to them about the benefits of spay neuter, and then really, connecting them with any other resources that they might need, which brings me to another wonderful part of this program that Houston Pet Set has enabled. We are able to provide people with pet food assistance, and that has been, people are just so beyond grateful for that help, especially, as times have gotten a lot harder with the coronavirus pandemic. So and then we just spay and neuter our little hearts out and send everybody home. We usually wrap up around 5 o'clock, pack everything back into the bus, and do it all over again the next day.
Wow, really great work. So noble.
You must be on site today. I think we hear one of your little patients in the background. So
yeah. There's a little gray pit bull that really thinks we all ought to be paying attention to her, and we should be, to be fair.
I have to tell my dogs all the time, give me some time because I got to get some other ones just like you off the street. So I'd love to spend all day playing with them, but yeah, they're looking at me now like, hey, what's up? But we got some other ones to save. So Dr. Crum, we know you're a great vet. You have a compassionate heart. You've worked in a bricks and mortar type setting, and you've worked in rescue. What is different about this mobile setting? What are you seeing that's different about the animals and the clients coming in that you might want to tell us about?
I think, so I've worked in high-end specialty clinics, and I've worked in, open admission government shelters, and I've worked in really well-funded private shelters. And I think what has struck me most about the patient base that we see providing free care out in the community is just how loved all of these pets are. They might have fleas, they might have heartworms, but they've got their little toenails painted, they've got little sweaters on, they've got a little kid hugging on them. These are family members, and they're really doing the best that they can to get them the care that they need. And so that's, it's so rewarding to be able to provide that.
It is rewarding. It's so wonderful to be able to help families with another family member. That's kind of the close-up view from a kind of a strategic position. How does this benefit a community? How does this impact the areas that you're in, and then overall that neighborhood, or maybe the whole community? What you're doing? What are the benefits of it for Houston?
Yeah, I think, the benefits for each individual animal are clear. We're treating painful conditions, we're preventing reproductive illnesses, we're preventing, unwanted pets. And so that prevents a lot of suffering as it is. But I think the human story often gets lost. And I've had so many people tell me, if we had to pay for this spay or pay for this veterinary care, we were going to miss rent, or we were going to, have to tighten our belts a little bit and make a meal last longer than we normally would. And so I think having people be able to access this resource is not just helping pets, it's of course helping people too. So I think we're making the entire Houston community healthier, not just physically, but mentally healthier with these services. And that's just great.
And I have one follow-up question to that. Do people ever have to relinquish their pets? Would they ever have to put them into a shelter system because they couldn't provide veterinary care? Have you had any cases like that?
A lot. That does come up a lot. A lot of times, especially with the injured pets, or even just with people who are getting behind on their preventive care and feel like they're doing their pet a disservice, they're at the point where they are ready to surrender that animal. And oftentimes, actually, they are at the shelter trying to surrender their animal so that their pet can get the care that they need. And it's really wonderful that the local shelters have really embraced this partnership, and they will refer those families to Laurel's House through the Houston Pet Set program, and avoid having to rehome that animal. And it's just, I wish I could, have you meet some of these families, but one man, he had 2 little boys, and he just started crying. He's like, I felt like such a bad father. I felt like a failure because I was going to have to give away my kid's beloved pet. So he was just really, really appreciative.
Those are such important stories. Thank you for sharing that.
It speaks to what Houston Pet Site identified a while ago, and that is not only do we need to adopt and need to transport and need to spay and neuter, but we need to care for the animals that are in homes. We have 300,000 unaltered pets in Houston homes, and those animals, without being spayed and neutered, are having puppies, and it's, if the owners can't afford to have the spay neuter surgery, we understand that. But what we want to do is provide that free service to prevent those unwanted animals, to stop the flow of animals into our shelter, because we know a lot of these owned animals are coming into the shelter system from owned homes, and it's clogging up the system for the homeless animals that are on the streets. So really important. You talked a little bit about what you're seeing with the people coming into the spay neuter unit. What are you hearing after? Do any of the people keep in touch? I know when we were out one day, one gentleman came back. His beloved dog had been hit by a car, couldn't afford the veterinary services. He came back. He was so grateful. Do you get a lot of these stories?
We do. We get a lot of thank you cards, a lot of messages and emails. People will stop us on the street. We're in a completely different neighborhood right now than we were when we helped the family that I have in mind. They came and knocked on the door to say, oh, hey, we saw you spayed our dog, way over across town, and we just wanted to say hi and tell you that she's so much healthier and happier, and we really appreciate it. So, it's really, the gratitude that people have has been pretty overwhelming.
So rewarding, isn't it? I can't imagine. So it's so wonderful to be able to help these families. Are there any specifics that people should look for before they reach out and ask about services with Laurel's House through the Houston Pet Set program?
Yes. So we do, there are a lot of, Houston does a pretty good job of having tiered veterinary care, and so there are several low-cost spay and neuter clinics in the area, and we do ask people to do some research if they can afford to go to one of those clinics. I think that is a good thing for them to do. They should research a little bit about aftercare or give us a call and ask us. We're happy to go over what that will entail. It is best for the pet to be inside for a couple of days after surgery, and that they should have a e-collar so that the pet cannot lick their incision, things like that. And, that cats will need to be in a carrier. A lot of people don't have a carrier before engaging in this process. other than that, we're happy to answer any and all questions if people want to give us a call. So
generous with your time and your resources.
And speaking of resources, we know that it takes a lot to keep these mobile units going. We know that you have a staff that you work with. You are out there as a vet, a professional vet, and we are also providing the food for a lot of these people. So if anybody's interested, there's a way to support this program that's so necessary in the community. And as we said before, it affects not only the people coming in and the animals coming in, it affects a whole community, because you have fewer running animals in those communities then. You have fewer animals coming into the shelters. And so this is an important program for all of Houston, I guess. And it's especially important if you've had an animal that you love, a special pet, and the thought of having to give that pet up because you can't afford it is heartbreaking. So, anyone with compassion and who's interested in this, they can contact Houston Pet Set, of course, to help support this. Is there anything else, Dr. Crum, that you'd like to add before we wrap up? Any anecdotes or anything you want the viewers to know about this program and what you do and anything?
I think it's just such a solid foundation to really attack the Houston animal welfare crisis where it's actually happening. We need spay and neuter, and the more families who have their pets spayed and neutered, the more familiar they are with that process, and the more commonplace it becomes, and the more resources we have in the community for them to access that veterinary care. Animal welfare is just going to continue to improve in our city. And I think that's everybody's goal, right?
You brought up a good point about taking the services to the people. It's so important. And that's what we can do with these mobile units. Bricks and mortar are so important too, but with the mobile units, we can actually take you and your crew into these communities where the majority of these strays are coming from, into the shelters. And we know that from data collection. But we can go right to those communities and do this hyper-local, very targeted approach to reduce the numbers of strays in those areas. So that is one thing that the mobile unit, how it differs from other programs that we've done. We can work right on the front line, so to speak.
It does give us a lot of flexibility to reach populations that we might not otherwise be able to. So.
And you're so generous with your time. It's so great, because we'll call you and say, Dr. Crum, there's a group that really wants, the mobile unit to come out just for a day. They've got all these people that they know of that need these services. They can't afford it. There's not a vet. What do you think? And we know you don't get many days off, if any, Dr. Crum, but you're always, yes, yes, yes. And you go out there, and we always find the funding. We figure out a way to do it. But we have a lot more of that. Now the word is out, and we're getting a lot more requests. So if we want to keep doing this, we do need that funding for it. So prayers and a lot of hope that we can keep at least one or two of these units going into 2021, because we know this is making an impact.
They are such a vital service, and we are just beyond grateful for the support from Houston Pet Set and Lola's Lucky Day and Fido Fixers and all of our partners to make this possible. It's just a huge blessing for our community.
It is such a blessing, and you're such a blessing to us, Dr. Crum. As Tama and you said earlier, this came together almost magically, and we know that there's a lot of magic, and there's a lot of God, and there's a lot of the universe working for the animals in Houston. So we're so grateful for this. Thank you for joining us today, for talking about the partnership and how it benefits Houston and how it benefits the animals. For anybody watching at home, thank you for joining us. Please connect with us directly at houstonpetset.org if you have any questions or would like to assist us. And as Tama and Dr. Crum said, funding is always appreciated, needed, for us to continue this important work. Even food donations, other types of resources are all that's very, very important. So thank you to everybody for watching. Thank you for your support of Houston Pet Set and everything that we all do together for the animals. Bye.
Bye, Dr. Crum.
Take care.